Hello, it's James Goolnik here from Optimal Dental Health. I'm a holistic or biological dentist, and I'm here to spend a few minutes with you talking about oral health myths dispelled. And I have 5 myths that I'm going to dispel with you. So, a little bit about me. I practice in London, in Baker Street. The nearest tube is Baker Street or Marylebone Station. And we have a multidisciplinary team, which means there's lots of people in the team trying to help people get healthier. And our philosophy is all about optimal health begins in the mouth. So whatever is in the mouth can have a systemic effect on the rest of the body. I'm a practicing dentist, and I've written 2 books. One is called Kick Sugar, which is a cookbook to try and get people to enjoy food without having loads of added sugar and carbohydrates. And the other book is called Brush. It's all about marketing and getting the right people into the right places. So this is our team. You can see there's quite a lot of us here, and we have pediatric dentists, we have implant specialists, we have biological hygienists, nutritionists, myofunctional therapists, psychotherapists, osteopaths. We have airway and breathing specialists, and we have an implantologist as well, who can help replace missing teeth with ceramic or metal-free options. So, number 1 myth that we're going to talk about today is oral health is cosmetic. It isn't cosmetic. And the interesting thing is the tongue is the barometer of the whole mouth. You might have seen about Chinese wisdom where you stick your tongue out and they can tell you what's going on. But actually, you can actually show more than 10 different diseases from the color of your tongue and the texture of the tongue, whether that's diabetes, vitamin B12 deficient or iron deficient anemia. And there was a study done last year where they took photographs of tongue and put it into AI software, and they were 94% accurate for looking for anemia, kidney disease, and hypertension as well. Diabetes, sorry. So that's one thing to have a look at, tongue, to see what's going on. And whenever you go and see your dentist, your doctor, get them to have a look at your tongue, because that will show you a lot more things of what's going on everywhere. And these are all the different signs you can see in the mouth of tongue issues. So you can see diabetes, that's a big thing. You can see cardiovascular disease, so heart disease. You can see autoimmune disease with mouth ulcers, so things like SLE, systemic lupus erythematosus, blood disorders, bleeding disorders, and HIV and GI tracts with mouth ulcers as well, so something to have a look at. And it's all about what's in our mouths. So the idea with our mouths is that we've got a whole mixture of bacteria. We want good bacteria and bad bacteria, and they're all living in harmony, and we can't survive without these bugs. And it first was invented in 1683 by Anton van Leeuwenhoek. And what he did was actually hadn't brushed his teeth for 3 days, and then took the sample and put it under the microscope and had a look and see what was going on. And from those bugs, he could actually see, and the picture on the top right-hand side is Streptococcus mutans, which is a bacteria that can cause tooth decay. So he was looking at that and showing us what was going on there. And we're actually, the microbiome in the mouth is the second most diverse microbiome, which is a connection of bacteria, protozoa, and viruses to the gut. And you will hear about the gut microbiome with Zoe and things like that, and gut microbiome tests and stool tests. But actually, the mouth is the entryway to it, so the mouth is the first place to go. And you can see in the mouth there's loads of different type of bacteria, and if you ever have a microbiome test, you'll see in all the different spaces in the teeth, the tonsils, back of the throat, they all have different populations of bacteria and things here. This is quite interesting. You're going to see here is on the top hand side, you can see the beforehand. This is patients who came to see us, and we took a swab from their mouth, and we're looking live at what's going on. And you can see here, especially on the top left-hand side, all the bacteria, and you can see spirochetes, and they're all basically having a party because there's so many bugs in there. And then the patient on the right-hand side wasn't quite as bad. You can see some white blood cells as well, showing signs of infection. And then after they had treatment with the hygienist and went through the brushing and cleaning techniques, you can see everything's a lot calmer. There's still bacteria in the mouth, but there's not as many bacteria in the mouth. And that's something that's really important for us to have a look at. And one of the most common bugs in our mouth is called P. gingivalis, or Porphyromonas gingivalis. And that's the one that can cause gum disease. And that actually, when you get these bacteria in the mouth, it should stay in the mouth. It shouldn't be anywhere else in the body. And when you have inflammation, the gums pull away slightly and you get bleeding. And then the bacteria that are there can actually then go into the bloodstream. and either can go up into the brain, or you can inhale them into your lungs, or you can swallow them, and if you haven't got enough stomach acid, they can go into your intestinal tract as well. So this is just showing here where the P. gingivalis can actually go into the brain, and shown in Alzheimer's disease, in cardiovascular disease, heart disease, obesity, diabetes, any sort of chronic inflammation like rheumatoid arthritis, and cancers as well. So it's really important to keep this bug as low as possible. We want some of it, but we want lots of it, and that's one thing you can do. And you can see here on this slide, this is a patient that had a dysbiotic mouth. So this is a person who had bad breath, and you can see all the things that are going on in their mouth, which is what we want to try and get rid of. So what sort of causes all of this? And there's a few different things. So first thing is you have lots of antibiotics. Antibiotics can disrupt the oral microbiome, and you're going to get more and more infections and problems there. Oral hygiene, if you're not cleaning well, then you get more of one type of bug than the other. Diet, depending what you eat and drinking, if you're having a lot of sugar and refined carbohydrates, processed foods, that can affect the microbiome. Alcohol, regular alcohol use, or even alcohol mouthwashes can cause these problems. Any sort of disease can affect the microbiome. So you've got a cold or flu or anything that affects it. Certain medications can actually make a difference with it. Obviously, your salivary flow, so if your flow of saliva is not as good, if you've had any sort of chemotherapy or you're having drugs that affect your saliva, that makes a difference. Some people, it's genetics, and also smoking can make a difference. And now they've been showing actually that vaping makes a difference as well. So why is the oral microbiome so important? There's a big correlation between what's happening in the mouth and the rest of the body. So if you've got problems with mouth health, you can have 25% increase in heart disease, cardiovascular disease as well. You've got 3 times increased risk of diabetes as well with gum issues. You've got a 20% increase in hypertension, which is high blood pressure. You've got a 3 times increase in obesity. There's 70% increased risk of Alzheimer's disease, and then SLS as well, and then squamous cell cancer. But all of these things are all about low-grade inflammation. We talk about chronic inflammation that's been on for a long time. And the most studied one is about diabetes and the body. So actually, there's what we call a bidirectional link. So people with diabetes have worse gum disease, and they have more obesity, and vice versa. If you've got gum disease, you're more likely to be obese, and you're more likely to be diabetic. So if you've somebody who's diabetic and we work on their gum disease, we can actually improve their diabetes as well, and vice versa. So it's what we call a bidirectional link between the two of the things. And there's obviously bigger issues as well with certain of the bugs can actually cause more problems. They go to the joints and the muscles and go to the heart, and also certain type of cancer. So that's why the mouth is really important, and the bacteria is really important in it. The other thing people think about is about how they can brush better. So they say, oh, it doesn't matter, I've just had a sweet, I'm going to brush my teeth straight afterwards and that will get rid of it. But actually, you can't outbrush a bad diet. It doesn't matter how much you brush afterwards, it will remove the food debris, but you're eating that, you're swallowing it, it's causing a systemic effect. So you can't affect it. And stress makes a big difference on our mouth health as well. So if you're more stressed, you're more likely to have a microbiome or bacteria that causes gum disease and tooth decay than anything else. So really important to work on the stress. This is a new paper to show actually there's a bacteria in the mouth called Fusobacterium nucleatum, which is not it's not found anywhere else but the mouth. But now they've been finding it actually in the colorectal area, so in the GI tract. And actually they were finding that these cancers had 50% more Fusobacterium nucleatum. So we need to get rid of it from the mouth, so therefore it doesn't go into the gut and cause further problems. There has been loads and loads of research on diet and how it can help grow your jaws and make sure everything is functioning better. And this is a dentist, Weston A. Price, in 1939, wrote this really interesting paper about the difference of the Aborigines when they moved to Western areas. They had more tooth decay, had more crowded teeth, and have smaller jaws. And they were because the foods were softer and they weren't chewing as much as well. And it made a big difference to all of that. So how do we get as much nutrients in our body as possible? Now, obviously, it depends on the food source. So if it's organic and where it comes from, the cooking method. So for example, vegetables, if you steam them, you're going to get more nutrients in them than if you roast them or boil them as well. The content of your meal, and then other things, the soil quality and how well your sort of digestive tract is at the moment. We've got a free guide to what biomarkers that are useful for oral health. So if you're interested, just send us an email below, and we will send you a free biomarker. So that tells you all the ones that are really important, what blood tests to do, what saliva tests to do, that make a biggest difference in it. And for us, the key marker is a thing called vitamin D. It's actually not a vitamin, it's an enzyme. And actually this, we can naturally make it in the sun, but in the UK, about 80% of us are deficient in vitamin D. You can also get some in your diet, some oily fish, some like salmon and mackerel, and also you can get it in butter as well. So looking at vitamin D and how it makes a big difference to oral health, it's the big driver. And you can get a blood test. We do here at Optimal Dental Health, finger prick tests. You can go to your doctor and get a phlebotomy blood draw and see. And ideally, we're looking for between 75 and 125 nanomoles per litre. And that's the best result to make sure you heal quickly, your bones are nice and strong, your immune system is gone, and you find you have less infections and less problems. And we like combining it with K or vitamin K2. So a lot of times when you buy nutrients and you buy your multivitamins or you buy your supplements, they have D3 and K2. So if you can buy them together, that actually facilitates the role of D, and it's also good for blood clotting as well. So the other thing we try and get with our patients is to try and get people to breathe through their nose as much as possible, because the nose naturally filters the air, warms the air, and as part of the immune system. And if you're breathing through the mouth, you don't have that filtration. You're more likely to get coughs and colds and infections. Also, you tend to breathe quicker as well, and your mouth dries up, and then there's more chance of having mouth cancer and also tooth decay as well. So really working on trying to get people to breathe through their nose as much as possible, and that really improves gum health. And just shows you here about all the different things with mouth breathing. Now, obviously, we always suggest people to start with mouth tape first, and you can do it during the day, just for sort of half an hour to an hour a day for a week. And if you manage to breathe through your nose and you're comfortable with that, then you start doing it overnight, and that will mean that you'll wake up more refreshed and have more energy for the day. So these are the sort of the benefits of mouth breathing and nose breathing. So for nose breathing, you get fresh breath, healthy gums, less cavities, less ulcers, and much nicer microbiome. And then if you're somebody that snacks occasionally, one of the things you can do to try and cut down on decay and problems with snacking is you can use xylitol chewing gum. And xylitol is a sort of sugar alcohol, and it actually naturally occurs in certain fruits and vegetables, but you can buy it in gums and mints. And so after each snack, you can have that, and that helps increase the salivary flow, washing everything away, neutralizing the acid, and also stop some of the bacteria sticking as well. So things you can do to improve your microbiome: don't share toothbrushes or little sticks. Tongue clean, so try and clean your tongue at least once a day, 3 scrapes, and you can use a spoon. You don't need anything special to do it, and that will help fresh breath and also help blood pressure control. Using some sort of floss or interdental brushes. Try and avoid mouthwashes. Avoid antibiotics as much as possible. Only need them if you really need to. And then stay hydrated as much as possible you can to increase your hydration. Breathe through your nose and eat a varied low sugar diet, and limit ultra-processed foods, and try and promote breastfeeding. And our last thing is be careful who and where you kiss them, because you will share the microbiome. Point number 3 is toothpaste is optional. So toothpaste is actually there to remove staining, and it's a medication to actually help harden your teeth and stop sensitivity and reduce tooth decay. A lot of the times in the UK, we talk about fluoride, and fluoride works, and fluoride definitely works to harden your teeth, remineralize it, slows down decay, but it works as a topical effect, so it works just on the surface of it. And if you have too much fluoride, you can cause fluorosis, and there's a question mark with neurodevelopmental defects as well, long term. So ideally, just brush with water. If you've got a lot of staining, then you can use bicarbonate of soda or something else. And then this is talking about where in the UK the area is fluoridated, and you can see the UK is about 10% fluoridated. And if you're worried about fluoride, there are only 2 sort of tried and tested ways to get rid of it. One is RO, or reverse osmosis, and the other thing is activated alumina, which are filters you can have in your water system to remove it. There is a product though that was working as well as fluoride now. It's called hydroxyapatite. It's actually naturally in our teeth surface already, and that is a safe alternative to fluoride, and it will help harden your teeth and reduce sensitivity as well. And in 2023, they did some surveys and have actually found that nano hydroxyapatite is the safest one, using up to 10%, and that's the one that's most evidence-based. There's loads of different types, but that's the one that's most evidence-based. But if you're going home now, look at your toothpaste, try and avoid one that's got SLS, sodium lauryl sulfate, which is like a foaming agent, and also with any sort of microbeads, triclosan, titanium oxide, which are all colorants, and you want an RDA value of under 70. So if it's over 70, that's a worry, because that shows basically the relative dentine abrasivity, which means it's basically how rough your toothpaste is. And so the carbon ones, the whitening toothpaste, they can be very abrasive and cause loads of problems and mean that your teeth will become more sensitive, more thinner, and wear down quicker. Nearly there. Number 4, bleeding gums are normal. So actually, if you brush your teeth in the morning, spit out, if you see any blood, that is not normal. That basically shows that the gums are inflamed and you've got one of these things called a cytostorm. And it basically means all the bacteria are getting in through the gum membrane and actually getting into the bloodstream and causing generalized inflammation. And then you get these pro-inflammatory mediators that you can see here, and then it all passes on to other sites in your body, whether it's the heart, the brain, the lungs, the fatty tissue in your joints, in the intestine, and kidneys as well, and pregnancy as well. So they do cross over. So that's called leaky gums. So we want to make sure that is gone as much as possible. And you've got a picture here with somebody with inflamed gums and swelling and bad breath as well. So if you've got bleeding gums, you need to be going to see your dentist. And last point is, all mouth bacteria are bad. There's lots of mouthwashes out there that they say they kill 99% of bacteria. We don't want that. We need the bugs in our mouth to help digest food, to help produce enzymes, to help produce vitamins and minerals, and we need them all to be in a symbiotic relationship, so be happier and healthier. And you can see here on the left, this is an oral microbiome test, and actually looking at what you're healthy compared to something else. And then we can do these tests and we can show you your medium risk or high risk for dental decay, dental caries, and we can look at that. And the ways to sort of change that, you can look at probiotics, which are live bacteria, to try and encourage growth. You can actually then use high dose of antibiotics targeted different things and certain mouthwashes for short time. And this is a picture of tooth decay, and again, down to combination of food, it's combination of what you're eating, how often you're eating it, and the time as well. So you see you need the sugar, the food, substrate, you need teeth to get tooth decay, it needs at least 3 months to work, and you need certain bugs to do it. So some people have more decay producing bacteria than others. So what we're looking at is what we can do to help change that for you, whether that is working on the saliva, working on your vitamin D levels, working on your snacking, or protecting the teeth with hydroxyapatite or something else like that. And it is possible to reverse tooth decay. It takes about 3 months. There are various different peptides that your dentist can place on to actually help remineralize or harden your teeth. But it's something that you need to really work on together, and you need to go through a diet sheet and everything else. And this is a thing called a Stefan curve, which shows us what we want is the pH of our mouths to be as neutral as possible and stable throughout the day. And every time you eat or drink anything, the bacteria produce acid, and it goes below 5.5. And you can see on that screen there, 5.5 is the level where the tooth starts to dissolve and what we call demineralize and decay. So what we're trying to do is keep the curve as high above that 5.5 as much as possible, so reducing the number of times you're eating and drinking during the day. And then when you do have a dip, when you eat something, bring it up as quickly as possible, which is having water afterwards, some cheese or something to neutralize whatever you've eaten, whether it's brushing, whether it's using xylitol, mints or gums as well. But ideally, the first thing we do is try and increase the gaps between each time you eat and drink to make that easier. And then also, there's been loads of studies on Alzheimer's disease and how there's a mouth connection to Alzheimer's disease. And Dale Bredesen, one of the neuroscience in the US, who did a lot of work on this from 2016 onwards, and looked at the different things that can have an impact on on Alzheimer's and cognitive decline. And in the mouth health, there were three pivotal things. One is the bacteria, so the microbiome, to see what bacteria and protozoa and fungus and viruses in your mouth. Second thing is on sleep apnea, we talked about earlier on, is making sure that we have enough oxygen saturation through at night when we sleep. And we want to really make sure that oxygen saturation is 95% and above. And if it isn't, then we need to look at how we can make appliances or something to encourage you to breathe through your nose, and also encourage you not to block your airway. And then the other thing is heavy metals, in particular mercury and metal fillings can cause people to have more issues in their mouth. So sleep is a big thing, and we work a lot with patients on sleep. We do overnight sleep tests and just see, you can use Oura rings or Whoop bands or Apple Watches or some way of tracking and looking at your heart rate variability, look at your heart rate, and then look at oxygen saturation throughout the night. And these are some devices that we can make called a mandibular advancement splint, and basically is like two mouth guards joined together, one at the top, one at the bottom, and it actually keeps your jaw open and your lower jaw from falling back and your tongue dropping back to block your airway at night. And this is a very simple test you can do overnight to actually see, are you snoring, are you breathing? Almost done now. We're just talking about mouth ulcers, very common. You can get them from trauma. You can get them if your toothpaste has a thing called sodium lauryl sulfate, which is like a foaming agent. Some people get them with celiac disease or gluten sensitivity, with candida, certain nutrient deficiencies. So if somebody's coming with me with multiple mouth ulcers and they're getting them all the time, stress is a big thing, but vitamin C, D, iron, B12 and zinc, you should check those out, because sometimes you get the first sign is actually of a zinc deficiency as a mouth ulcer. So if you can correct the zinc, you'll stop the mouth ulcers. Hypochlorhydria, microbiome dysbiosis as well. So again, so if we've got a mouth ulcer like that, these are the tests we would do: full blood count, iron panel, zinc, B12, vitamin D, vitamin K, HbA1c, which is like blood glucose control, and magnesium as well. And then you can get these tablets that can help try and slow down the infection. But the most important thing is to try not to touch them so they don't get secondary infected. But if you had an ulcer that hasn't healed after 2 weeks, you need to refer. So this is us, Optimal Dental Health. We get as much information as possible. We spend at least an hour with you to find out about your sleep, your hydration, your exercise, your stress, and nutrition, what diets you have, what supplements you have. Then we do tests to see what's going on with whether it's blood test, overnight sleep test, or x-rays, and we can do 3D x-rays now rather than 2D, and you can actually see what's going on in way more detail. And you can see on this x-ray there was nothing going on, but somebody had pain in one of their teeth. And when we do a 3D scan, you can see a big ulcer there. We collaborate with loads of other specialists. We work with osteopaths, we work with chiropractors, we work with functional medicine doctors, normal doctors, nutritionists, and trying to find out what the root cause of why things are going on. Our big philosophy is always food first, then we look at supplements for short term and where the areas are missing, and then looking at treatment and then retesting. Did it work? How do you feel? Do you get more energy? Do you sleep better? And are you getting less tooth decay and less gum disease and less bleeding and less bad breath? So we're looking at various markers so we can see, does it work? So from today, hopefully you've learned a little bit about nose breathing and how that's most important in trying to encourage yourself to breathe through the nose as much as possible. Cleaning it using a tongue scraper at night, just once a day, to help remove the bacteria and freshen up your breath. Always asking about the mouth, and if your dentist isn't, and then have a relationship with a biological dentist. So that's me. You've got my email there, and if you're on LinkedIn, you can contact us there. I hope you enjoyed this, and it was great spending some time with you.